Welcome to today's session on developmental disabilities. My name is Judy Steik, and I'm a nursing instructor at Central Wisconsin Center in Madison, Wisconsin. Central Wisconsin Center is a home for people with developmental disabilities. Developmental disabilities means that normal physical and/or mental development did not occur due to birth defects, injury, or illness. Developmental disabilities is a general term that covers many different physical and mental conditions. For example, cerebral palsy is a developmental disability that can occur in mild to severe forms. Developmental disabilities are also caused by autism, spina bifida, hearing impairment, visual impairment, hydrocephalus, and microcephalus. These are only a few of the conditions which can cause developmental disabilities. There are hundreds of known causes of developmental disabilities, as well as many unknown causes. Some developmental disabilities affect physical function, some affect mental function, and some affect both. Persons with mental retardation are developmentally disabled. However, not all people who are developmentally disabled are mentally retarded. Mental retardation is a medical diagnosis. People should not be referred to by a medical diagnosis. People who are mentally retarded are people with developmental disabilities. Most people with developmental disabilities are affected mildly. With early intervention, special education, and community living support, many can lead independent lives. A small number have more serious problems and may not be able to live independently, but with consistent daily teaching and guidance, they can succeed to the best of their abilities. Developmental problems influence the way people think, learn, and behave. Characteristics of a developmental disability are that it is caused by a mental or physical impairment or both, generally can occur before age 18 to 22, and is likely to continue throughout the person's lifetime. The disability results in functional limitation in 3 or more of the following activities of daily living: self-care, use of language, learning, mobility, self-direction, independent living, and economic self-sufficiency. Well, what causes developmental disabilities? There are hundreds of known causes of developmental disabilities as well as many unknown causes. Developmental disabilities can affect physical function or mental function or both. Developmental disabilities can occur before birth, during birth, or after birth, before ages 18 to 22. Before birth, some of the causes of developmental disabilities can include genetics. Some of the most common genetic disorders might include Down syndrome, Fragile X syndrome, Prader-Willi, and Angelman syndromes. Another cause of developmental disability before birth could be fetal alcohol syndrome, and in fact this is the #1 cause of developmental disabilities before birth. Fetal alcohol syndrome is related to excessive ingestion of alcohol during pregnancy, especially during the critical first trimester when neural development of the fetus occurs. Medications taken by the mother before birth can also be a cause of developmental disabilities. And these medications can even include over-the-counter medications, and often physicians will not prescribe medication during that first trimester for the simple reason that it could cause a disability in the child. Yet another cause of developmental disability before birth could be poor nutrition of the mother. So good prenatal diet is very important. And finally, another cause before birth could be infections that the mother may have, such as rubella, which is also known as German measles. Rubella can cause significant defects in the developing fetus. That is why it's so important for the mother's immunization to be up to date before pregnancy. During birth, developmental disabilities can be caused by trauma during the actual birth process, whether during labor or delivery. Anoxia, or lack of oxygen, can also be a cause of the disability during birth. After birth, developmental disabilities can be caused by lead poisoning, or chemical ingestion, or even some medications. Trauma and accidents such as head injuries, child abuse, or drowning can also contribute to developmental disabilities after birth. And then there's a whole group of infections that could occur after birth, such as meningitis, encephalitis, or measles, a common childhood disease which could be prevented with timely immunizations. Developmental disabilities are caused by many conditions that affect the way a person thinks, learns, and behaves. Developmental disabilities can be very mild, or they can be severe. These conditions occur before, during, and after birth. And many of the causes of developmental disabilities can be prevented. Preventable forms of developmental disabilities can occur before birth, during birth, and after birth. Ways to prevent developmental disabilities before birth can include immunization of the mother prior to pregnancy. Good prenatal care can also prevent many forms of developmental disabilities, especially those related to premature births, improper nutrition of the mother, medications, alcohol, or drugs taken by the mother during pregnancy. During birth, good prenatal evaluation and the availability of emergency equipment during the birth process can prevent trauma and lack of oxygen during that birth process. After birth, immunization can prevent many infections that can cause developmental disabilities. So it's very important that immunizations be given in a timely manner. Preventing child abuse through parental education and counseling can prevent some of the traumatic causes of developmental disabilities. Poisonings from lead or household chemicals and medications can be prevented by removing these items from the child's environment and childproofing the home. Head injuries can be prevented by using appropriate child seats correctly placed in cars and wearing helmets for bike riding and other sports. The Americans with Disabilities Act, or ADA, guarantees people with mental and/or physical disabilities the same opportunities as others in earning a living, using public and private services, buildings, and transportation. Under the law, discrimination against people with developmental disabilities is illegal. Individuals with developmental disabilities who have physical or cognitive limitations may have reduced opportunities for participation in the life of their community because of these limitations. Providing adequate supports and enhancing their functional level can increase inclusion of persons with developmental disabilities into the life of the community. It is important to teach functional skills to people who have developmental disabilities. Teaching functional skills provides an active treatment plan that respects the client's right to live and function to the best of their ability. Active treatment is defined by law as an ongoing, organized effort to assist each person to attain or maintain developmental capacity through regular participation, in accordance with an individualized plan, in a program of activities designed to enable the person to attain or maintain the optimal physical, intellectual, social, and vocational levels of functioning of which they are capable. Functional skills are activities that are practical and provide a useful purpose for the client. Functional skills include activities associated with daily living and occupational or educational settings. This may occur in homes, training centers, places of employment, or anywhere in the community. Promoting independence and the highest level of functioning is important for all people. Increasing a person's ability to care for themselves and to be independent increases self-esteem and self-direction. It encourages physical health and mobility. It increases social participation and the general developmental level. Advantages of teaching functional skills to people with cognitive and/or physical disabilities include it increases self-direction and ability to choose, increases self-esteem and self-worth, increases social participation and social acceptance, increases mobility and physical independence, increases possibility to maintain physical and mental health, and increases ability to care for themselves. Teaching functional skills to people with cognitive and/or physical disabilities provides an active treatment plan and demonstrates respect for the client's right to be as independent as possible. Clients are always ready to learn. A functional assessment will help to determine skill levels in many areas. Priority of learning needs are determined with the input of the client. Then, using the functional assessment, the caregiver must decide how to adapt the learning activity so that it will meet the individual needs and abilities of that client. The caregiver needs to engage the learner and modify the technique and the environment to accommodate the client's needs. Teaching strategies can include teaching one skill at a time. Break down each skill or task to be taught into simple steps. This is called task analysis. Give short, simple directions and be consistent that you're using the same directions each time. Have short teaching sessions to avoid fatigue and frustration. And be sure to reduce distractions in the environment. Be sure the environment's quiet, that you're not going to be interrupted by a lot of people. Or turn off the radio and make sure the TV's not in the background. Use frequent repetition of teaching sessions, demonstrations, and directions. And allow the client to perform the skill. Give them time to perform each step of the skill. It may be faster for you to do it yourself, but the client needs time and patience to learn to do the skill. And always be sure to make the learning fun. There are many ways that you can adapt an activity into a game, for example, and make it really fun for the client to learn. Other things to keep in mind in your teaching strategies is to schedule teaching sessions for times that the activities normally occur, such as teaching feeding skills during mealtime and other activities of daily living during the times that those activities normally or naturally occur throughout the client's day. And of course, take advantage of teachable moments. You never know when you might just have that moment that you can really clinch that skill for that resident or the client. And so use those teachable moments as well as your scheduled teaching times. Some of these strategies are used in the following teaching sessions.
The training begins with laying the shirt front side down on a bed or table with the bottom toward the client.
Front down, the front side down? Yeah. Okay, let's lay it out and make it all smooth. Make it all smooth? Uh-huh. Let's see, yeah. Okay. You look and see, is it smooth? Uh-huh. All right, good job. See, the front side's down. Okay, now Lori, can you grab back here? Mm-hmm. Let's see ya. Let's see, grab right here. Take a hold right here. There you go. Good job. Hang on to that, though, because you're going to put your other arm inside there. No. Put your other arm all over. Whoop. All right, good. Good job, Lori. Let's put your other arm in. You put your other arm in here. Lori, this arm. There you go. Let's put it over your head. And you pull it down in the back, too. And you pull it down in the back. Very, very good. Good job, Lori. Good job.
There are different methods for teaching skills that can help to guide a client from dependence to independence. Not all clients will respond to all methods. For example, a client may be able to respond to a verbal cue, while others may need more physical guidance. The following methods will demonstrate how to progress from the most assistance to the most independence.
The most dependent level of the teaching sequence is the motoring prompt. The trainer tells the learner what to do while physically guiding her through the desired action.
Maggie, pick up the soap. Good, great. Good job, Maggie. Maggie, plug in the blow dryer. Plug in the blow dryer. Good job, Maggie. Super. Maggie, put your arm in the sleeve. Good job, Maggie. Super.
Next level is the partial physical prompt, where the trainer tells the learner what to do while guiding her to start the desired action.
Maggie, pick up the soap. Great, good job. Maggie, plug in the blow dryer. Great, good job, Maggie. Maggie, put your arm in the sleeve. Good job, Maggie.
Verbal gesture prompt. The trainer tells the learner what to do while gesturing, which could be pointing, tapping, waving, etc., to help focus the learner's attention.
Maggie, pick up the soap. Good job, Maggie. Great. Maggie, plug in the blow dryer. Great. Good job, Maggie. Super. Maggie, put your arm in the sleeve. Good job, Maggie.
The modeling prompt is the next level of the teaching sequence. At this level, the trainer demonstrates the desired action while telling the learner what to do.
Maggie, pick up the soap. Pick up the soap, Maggie. Good, super, good job, Maggie. Maggie, plug in the blow dryer. Maggie, plug in the blow dryer. Good job, Maggie, super. Maggie, put your arm in the sleeve. Good job, Maggie, great.
The next level of the teaching sequence is the verbal prompt. Here, the trainer tells the learner what to do.
Maggie, pick up the soap. Good job, super, Maggie. Maggie, plug in the hairdryer. Good, great, good job, Maggie. Maggie, put your arm in the sleeve. Good job, Maggie, super.
The highest level of independence in the teaching sequence is completed independently. At this level, the learner requires no prompts from the trainer to complete one or more steps of the skill. For example,
Hi, Maggie, it's time to brush your teeth.
you announce to the learner, "It's time to brush your teeth." Without any further direction, the learner goes to the bathroom sink and takes the toothbrush and toothpaste from storage. The learner then requires prompts to complete the remaining steps of this skill. The first two steps, going to the sink and obtaining the toothbrush and toothpaste, were performed at the completed independent level.
The frequency and combination of methods will vary from client to client and skill to skill. Remember, our prime goal is to develop the client's independence to the greatest extent possible. Teaching loops is a technique used to ensure that clients will always be successful when performing a skill. The client is given a cue or direction to perform a skill, and when the client performs the skill, the behavior is reinforced. The reinforcement is something that the client views as a reward for performing the skill. An example of reinforcers may be something as simple as eye contact, or a pat on the back, or positive words of approval. Reinforcements may occur immediately or may be delayed. At times, a client may need to be redirected back to the task at hand. The caregiver may have to ignore some inappropriate behavior, then redirect and reinforce the client. The reinforcements for the clients we saw earlier were simple words of approval and encouragement. Learning functional skills should be a time of success for the client. Teaching functional skills can enhance a person's ability for independence, self-direction, self-care, self-esteem, participation in community activities, and physical and mental health. Teaching functional skills is an important part of the care of persons with disabilities. It enhances the general quality of life and allows persons to more fully participate in all that life has to offer.